Hello, everyone, and welcome to today's discussion. Today, I'm going to outline some of the reasons why I believe that the United States should not move to a universal healthcare system. There are a number of advocates for such a system, including Bernie Sanders and Andrew Yang. In fact, Andrew Yang is running his entire platform as this being a major issue, providing universal healthcare to everybody in the United States. On the surface, it may seem like a good idea, but if we dig a bit deeper, we can see some of the issues that arise with such a system. Now, my aim today is to encourage everyone listening today to consider the possibility that despite the arguments used, such as it works in Australia or it works in Sweden, that the US should necessarily take the same course of action, which I don't believe is the case. It is my hope that today I can make arguments that will encourage the United States to pursue a course that is different, that is unique to the United States, to the culture of the United States, to the economy of the United States, and hopefully we can carve a new path for ourselves that will show the world that there are different systems, different ways that we can achieve the same goals of providing affordable, accessible, and quality health care to everybody in the United States. Healthcare for a long time has been the subject of fierce debate. It is not a new discussion, even in the United States. And there have been many advocates for the universal healthcare system. Media outlets report on the inefficiencies of the U.S. healthcare system and the plight of those that are underinsured or not insured at all. My aim is to offer some perspective on things that aren't always talked about in the complex issue of delivering quality and affordable healthcare to 327 million people. So how many people have health insurance in the United States? In 2017, the figures are 294.6 million people, or 91.2% of the population. The insurance coverage comes from a number of places. Employers provide the majority of health insurance at 56%, Medicaid provided for 19.3%, and Medicare at 17.2%. 16% of the population purchase their insurance directly through the insurer. Those with coverage from the military make up about 4.8% of the coverage. So why are there so many uninsured? Why are there so many people who are uninsured or underinsured? It's an important question that we need to ask. Now, the assumption might be that people are just destitute and they don't have the money to pay for it, and that is true. In many cases, it will be true. But Neil Mahoney outlines some arguments in the American Economic Review, stating that bankruptcy is one of the main arguments used to point out the failings of the system and to advocate for universal health care. But some of the estimates around the severity of medical bankruptcy and the frequency in which it happens have been contested. Bankruptcy is not always a foregone conclusion. Neil points out that the bankruptcy filings often involve the negotiating period where payments may be arranged based on the ability to pay. Neil Mahoney's last words in his conclusion is that too many households choose to be uninsured on the margin. That means there are people who are weighing up the risk involved, the price of health insurance, and saying to themselves, okay, I might get hurt, I might not. In the meantime, I can pay for cash for different services, and I'll take the big risk on the major catastrophic injury. And if worst case scenario comes to be, I can declare bankruptcy and it'll act as some kind of implicit health insurance for them. So let us not assume that the 28 million people that are not insured because they are destitute. There are people who make the conscious choice to go without coverage when they could otherwise pay for it. Another incentive to not pay for health insurance are the savings that are found when a person pays up front in cash rather than through health insurance. There are a number of other brokers that pair cash buyers with physicians such as Helora. Not every procedure will be available for a cash arrangement, but the savings are quite considerable. The Wall Street Journal reported that a knee x-ray would cost a patient $600 using her insurance, or $70 paid in cash. Another report from the LA Times found that simple blood tests cost $80 if billed to Blue Shield, or a cash price of around $15. So why is healthcare so expensive in the United States? There are a number of reasons this is the case. One of the issues with the U.S. healthcare system is that whenever something doesn't go to plan with a procedure or surgery, doctors and healthcare institutions are at great risk of being sued for medical malpractice. In response to the litigious nature of the United States, doctors and health insurance institution and healthcare institutions must protect themselves, and they do this in two ways. The first is to take out insurance for medical malpractice lawsuits. This is an ongoing cost they must pay to protect themselves. There isn't a register that keeps track of all the total cost of litigation in U.S. medicine, but one source puts the figure for only physicians and not institutions, at $4.24 billion per year between 2004 and 2008. The second thing doctors will do is practice what is called defensive medicine. Defensive medicine, by one definition, is when doctors order tests, procedures, or visits, or avoid certain high-risk patients or procedures, primarily, but not necessarily solely, because of concern about malpractice liability. Dr. Urvashi Bhattara noted that the practice of cesarean birth is developing due to non-compliance of patients to take risk and the apprehension of clinicians to undertake risky procedures. Patients want zero risk for themselves and the baby, which is not possible, and clinicians, due to fear of litigation, avoid risky procedures such as trial of scar, VBAC, and have more bias towards cesarean section. Now, considering for a moment the wider implications of a litigious culture, it not only affects the doctor and patient relationship, but wider society as well. J. Mark Ramsire and Eric B. Rasmussen put it well when they said of these types of litigation, quote, "They can profoundly affect the social relations and economic structure within a country, but not because they are common or because they protect property rights. They affect social relations and economic structure because, despite their scarcity, they discourage investment and cause firms to take precautions of little social value." And that is very much what is happening today with doctors who are ordering tests and doing everything they can to cover themselves, sometimes at the cost to the consumer. And we can also see that money is being changed hands, not into investing in new technology, not into driving prices down, but just to cover for the costs of mistakes that doctors might make. The next thing I want to discuss is the issue of monopoly. As healthcare costs have risen, the number of insured people has declined considerably. I suspect there has also been an association in decline in the number of available funds, as people are funneled into one pool to be able to cover the collective costs of the whole. There's a general lack of competition in the health insurance market in the U.S. I'll point to the case of Alabama. The major insurance provider there insures 89% of the people. That is due to the reputation of trust that has been established there, but the lack of competition can lead to inflated prices. The other issue is that Alabama is home to many unhealthy people, so it is not an attractive market for new players. There are a number of other states that also experience a lack of competition in health insurance. Another related issue is the very thing it might be praised for, that businesses provide coverage for 50% of the population. The 50% get healthcare through their employers distorts the market and punishes anyone that pays for it up front. The health insurers are competing for businesses rather than to individual buyers, as you might find in Australia. Businesses can capitalize on economies of scale, where individual families cannot, so they are at a disadvantaged bargaining position or buying position in comparison to big companies, and it distorts the price that the individual may have to pay because they cannot take advantage of the same advantages that big businesses have. Now, in Australia, the system is different. For example, you might be given private health insurance as a benefit from your employer, but what they will do is they will give you a cash amount. They'll give you $1,000 a year or something like that, and they will give you that cash and allow you to go and pay for your own health insurance wherever it is that you want to put your money. And you can go above or beyond the amount that you were offered, but all you have to do is to prove that you have a health insurance policy with your employer, and they will continue to pay you that benefit. Now, that would allow a lot of companies, insurance companies in the U.S., to compete for individual families rather than competing for big businesses. It is a better solution than the current system that is in America. And the current system in America actually detriments the individual families. So there's some change that could be had there. The next question I want to address is the issue of lack of availability of health insurance, and is that leading to people who are dying on the streets? My simple answer is no, and here's why. Despite the internet being awash with these horror stories of the underinsured and uninsured, people getting slapped with bills they can't afford. There is still in America this concept of private charity, and public charity, in fact. The site GoFundMe.com is a popular platform for raising funds for projects and innovative ideas. It is also a place where people get help for their medical bills. About 1/3 of all the money raised on GoFundMe is for medical bills. Now, that may seem like an issue, but what I think is good about it is individual families, communities are able to pay some of their income to help out other people. And it is no different, as far as I'm concerned, from the government, who takes the money from your bank account and then distributes it as they desire. A GoFundMe campaign is targeted. People can pay what they are able to pay, and I'm sure many people have had alleviation of their suffering and discomfort from healthcare burdens alleviated in that way. So it is a positive thing. One level in which the law is on the side of those who can't pay for whatever reason is the Emergency Medical Treatment and Labor Act. It is a federal law that requires anyone coming to an emergency department to be stabilized and treated, regardless of their insurance status or ability to pay. In addition to legislation that supports those that may not be insured, the U.S. health system, both for-profit and non-profit hospitals, provide what is called charity care. Charity care is health care provided to those with low incomes and is a direct cost to the hospitals that provide the care. Hospitals can either write the costs off as bad debt or report it as charity care. Nonprofit hospitals bear most of the burden of providing this charity care, and for doing so, they enjoy tax-exempt status. The cost to provide charity care is quite significant, with one estimate from 2001 putting the total cost at $34.5 billion. One hospital alone in Washington provided $25 million in charity care, and the state as a whole wrote off $772 million in charity care in 2017. So where do we go from here? There are a number of solutions we can look at when dealing with the issues of healthcare in the United States. Unfortunately, it seems everyone is looking only to a single solution, the universal care or single payer model. Thus far, as outlined by Michael E. Porter and Thomas H. Lee, there have been a number of narrow solutions, many that have come from outside stakeholders. These magic bullets, as they say, have failed to address one of the fundamental issues at the heart of healthcare in America, and that is low value. Porter and Lee offer some insight that I think is worth consideration. The first point is on creating integrated practice units. Integrated practices organize around a patient's medical condition rather than organizing in silos by specialty department. The restructuring of healthcare organizations is illustrated well by the Cleveland Clinic, a care provider that is seen as demonstrating excellence. Among the basic questions about healthcare is how hospitals need to evolve, and this is the Cleveland Clinic speaking. There are some big issues. Number one is functionality. The brick-and-mortar hospital offering all things to all patients is obsolete. It originated in a different environment where there were fewer treatments, and one facility could deliver adequate care to anyone who walked through the door. That doesn't work anymore. No single site can provide state-of-the-art care in every specialty. No standalone hospital can afford all the latest technology. Clinging to the old model has led to wasteful duplication of services and roadblocks to quality and safety improvement. Close quote. Now, Porter and Lee gave the example of Virginia Mason Medical Center and their treatment of lower back pain. From initial call to treatment, that specific issue was addressed in a streamlined and efficient way, and the results were fewer physical therapy visits and fewer missed days of work. I find this an important point from the article. Quote, Virginia Mason did not address the problem of chaotic care by hiring coordinators to help patients navigate the existing system, a solution that does not work. Rather, it eliminated the chaos by creating a new system in which caregivers work together in an integrated way. Other solutions they have are measuring outcomes and costs for every patient, moving to bundled payments for care, integrated care delivery systems, and building an enabling information technology platform. All of these measures are outlined in the Harvard Business Review, and I highly recommend reading them. They are useful solutions with a goal to add value that doesn't involve more legislation and government intervention. Another solution I find quite inspiring comes from a woman that has decided to run a practice by completely avoiding the insurance system altogether. She's looked at the healthcare system and decided that the best way she can provide care to people is to split from the current system and go her own way. Her name is Dr. Julie K. Gunther, and she started Spark MD after experiencing for herself how much time she spent doing paperwork and other administration instead of working with people. She was inspired by a company called Atlas MD that works with doctors that want to provide a direct primary care model for their patients. The model of care she is employing is helping her patients save money on their prescriptions and other medical costs. She uses the analogy of a car and car insurance. Car owners insure their car in the event of a major incident, and for servicing, oil change, and day to day maintenance, they pay in cash. The system she promotes is similar: pay for checkups, basic treatments and tests, and insure for injury shocks. Now, I don't think it would be fair to say that the direct care model like SparkMD and others is the best way to go, or that the entire system can adopt this model. It's simply a solution that has arisen from physicians addressing issues in their field of work. There are wider plans or solutions that can be employed, such as those put forward in the Harvard Business Review. Now, today I've tried to highlight some of the complexities of the system we have to work with. I hope I've offered some perspective on the prevailing narratives that paint the US healthcare system as totally broken and beyond repair. There are solutions we can employ, and it is my view that we are too quick to look to a single payer system, which would only lead to injecting more public money into a machine that is inefficient and costly. If we change the structure of the system and address key issues from the ground level, led by physicians with patients in mind, then perhaps the United States can show the world that the universal healthcare system is not the only option to envy in the world. Thank you for listening to my arguments. Please let me know if you agree or disagree in the comments, and let's further this discussion so we can get to the bottom of it and find a solution that's going to suit the United States of America. Thanks very much.